Hey everyone, welcome to my channel. Today, we are discussing Mpox. This is why you need to pay attention to Mpox in 2025. When you think about health threats this year, Mpox might not be the first thing that comes to mind. But here's something surprising. Mpox is still a real concern, even today. While it may not dominate the news cycle like it did a few years ago, the virus hasn't vanished, and the risks it poses are still very much present. Many people assume that if something isn't making headlines, it's no longer a problem. But with infectious diseases like Mpox, that's simply not the case. In fact, letting our guard down can make it easier for outbreaks to happen again. Welcome back to Health on Hand, your trusted source for up-to-date health information. Today, we're diving deep into the facts about Mpox, what it is, why it still matters, and what you can do to protect yourself and those around you. Whether you're a healthcare worker, a parent, a student, or just someone who cares about staying healthy, this episode is for you. You might have noticed that Mpox isn't making front-page news anymore, but that doesn't mean the threat is gone. In fact, the virus continues to circulate in certain regions, and new cases are still being reported. Sometimes, when public attention fades, so does our vigilance, and that's when diseases like Mpox can make a comeback. It's important to remember that infectious diseases don't just disappear because we stop talking about them. Infectious diseases have a way of resurfacing, especially in places where people become less cautious, or where public health resources are stretched thin. Mpox is no exception. Outbreaks can happen when we least expect them, particularly in communities where vaccination rates are low, or where people aren't aware of the symptoms. That's why it's so important to stay informed and proactive. By keeping ourselves educated about Mpox, we can recognize the signs and symptoms early, like unusual rashes, fever, or swollen lymph nodes, and seek medical help before the virus spreads further. Early detection is key to stopping outbreaks in their tracks. Public health workers are still out there, sharing information and resources to help communities stay safe, but it's up to all of us to pay attention and take action. In this video, we'll break down exactly what Mpox is, how it spreads from person to person, and the most effective ways to protect yourself, your family, and your community. We'll also talk about the latest research, prevention strategies, and what to do if you think you've been exposed. Understanding the facts can help you make smart choices and reduce your risk. We'll take a closer look at where Mpox outbreaks are happening right now, both locally and around the world. You'll see how public health teams are responding, what's working, and what challenges remain. Knowing where the risks are highest can help you stay one step ahead and make informed decisions about travel, gatherings, and daily routines. Remember, knowledge truly is power. The more you know about Mpox, the better prepared you'll be to protect yourself and your loved ones. We'll share practical tips, answer common questions, and give you the latest updates so you can feel confident and empowered. So let's dive in together, stay informed, and make sure we're all ready to face whatever comes next. Your health, and the health of your community, depends on it. Mpox, which was previously known as monkeypox, is a rare but potentially serious viral disease that belongs to the same family of viruses as smallpox. While smallpox was eradicated decades ago, Mpox continues to circulate in certain parts of the world, and understanding its origins and transmission is crucial for public health. The virus itself is part of the orthopox virus genus, which means it shares some genetic similarities with smallpox, but it is generally less severe in its effects on humans. Scientists first identified Mpox in 1958, when outbreaks occurred in monkeys kept for research, which is how the disease got its original name. However, despite the name, monkeys are not the main carriers of the virus. In reality, Mpox is mainly found in small mammals, especially rodents, that live in the dense forests of Central and West Africa. These animals, such as squirrels, rats, and dormice, are considered the natural reservoirs of the virus. The virus can circulate silently among these wild animals for years, occasionally spilling over into humans when there is close contact. Monkeys and other primates can also become infected, but they are not the primary source of the virus in nature. Scientists have identified two main types or clades of the Mpox virus. Clade 1, sometimes called the Congo Basin clade, is more severe and is found primarily in the Congo Basin region of Central Africa. This type of Mpox is known to cause more serious illness in people, with a higher risk of complications and even death, especially in those with weakened immune systems or in young children. The Congo Basin clade has been responsible for most of the severe outbreaks reported in Africa over the past several decades. The second type, known as clade 2 or the West African clade, is generally less severe and has a lower fatality rate. However, it is this clade that has been responsible for the recent global outbreak, which began in 2022 and spread to countries far beyond Africa. The spread of Mpox to new regions has raised international concern, as it highlights how quickly infectious diseases can travel in our interconnected world. Global health organizations have responded with increased surveillance, public health alerts, and efforts to educate the public about the risks and prevention strategies. Mpox is a zoonotic disease, which means it can jump from animals to humans. This usually happens through direct contact with the blood, bodily fluids, or skin lesions of infected animals. People living in or near forested areas where the virus is endemic are at higher risk, especially if they hunt, handle, or prepare wild animals for food. Local markets that sell bushmeat, meat from wild animals, can also be hotspots for transmission, as the virus can be present in the tissues of infected animals even if they appear healthy. Eating undercooked or raw meat from infected animals is another significant risk factor for Mpox infection. The virus can survive in meat that has not been properly cooked, so consuming such food can lead to human cases. This is why food safety and proper cooking practices are so important in areas where Mpox is known to circulate. Educating communities about the dangers of eating undercooked bushmeat is a key part of prevention efforts. Once a person is infected, Mpox can also spread from person to person. This usually happens through close, direct contact with the rash, sores, or bodily fluids of someone who is sick. The virus can also be spread through respiratory droplets during prolonged face-to-face contact, such as when caring for a sick family member or in healthcare settings. This is why outbreaks can sometimes occur in households or among people who have close physical contact. The Mpox virus can also linger on objects and surfaces that have been contaminated by an infected person. Bedding, clothing, towels, and other materials that come into contact with the rash or bodily fluids can carry the virus for some time. This means that touching these items and then touching your own face, mouth, or eyes can potentially lead to infection. Proper cleaning and disinfection of contaminated items are essential to prevent further spread, especially in hospitals and homes where someone is sick. Practicing good hygiene is one of the most effective ways to protect yourself and others from Mpox. This includes washing your hands frequently with soap and water, especially after contact with sick people or animals, and avoiding close contact with anyone who has symptoms of the disease. Healthcare workers and caregivers should use personal protective equipment, such as gloves and masks, when caring for patients. Community education about these simple but important steps can make a big difference in stopping the spread of the virus. By understanding how Mpox spreads and taking steps to prevent infection, we can help break the chain of transmission and protect our communities. Awareness, education, and simple hygiene practices are powerful tools in the fight against this disease. The more we know, the better prepared we are to respond to outbreaks and keep ourselves and our loved ones safe. Recognizing Mpox symptoms early is crucial, not just for your own health, but also to help protect those around you. Mpox can sometimes be mistaken for other illnesses, so being aware of the specific signs can make a big difference in getting the right care and stopping the spread. If you think you might have been exposed, pay close attention to how you're feeling, and look out for any changes in your body. The first symptoms of Mpox often feel a lot like the flu. You might notice a sudden fever, chills, or a general sense of feeling unwell. Headaches are common, and you could also experience muscle aches and back pain. Fatigue is another early sign. Many people feel extremely tired and may want to rest more than usual. These symptoms can last for a few days before anything else appears, and it's easy to dismiss them as just a regular cold or flu, so it's important to stay alert, especially if you know you've been in contact with someone who has Mpox. One of the most distinctive signs of Mpox is swollen lymph nodes. These are small bean-shaped glands that can be found in your neck, armpits, and groin. Swelling in these areas can be uncomfortable or even painful, and it's a key symptom that helps doctors distinguish Mpox from other viral infections like chickenpox or measles. If you notice lumps or tenderness in these areas, it's a good idea to seek medical advice. After a few days, a rash usually develops. This rash often starts on the face, but it can quickly spread to other parts of the body, including the hands, feet, chest, and back. The rash can be itchy or sore, and it's one of the most visible signs of Mpox. Sometimes the rash may also appear inside the mouth, on the genitals or around the eyes, making it important to check your whole body if you suspect you might have Mpox. The rash goes through several stages. It starts as flat red spots which then become raised bumps. Over time, these bumps fill with clear fluid, turning into blisters. Eventually the blisters become pus-filled and then begin to crust over. As the healing process continues, the scabs fall off, sometimes leaving marks or scars behind. This entire process can take several weeks, and it's important not to pick at the rash to avoid infection or scarring. Most people with Mpox recover fully within 2 to 4 weeks. During this time, it's normal to feel tired and need extra rest. The rash will gradually heal, and as the scabs fall off, you'll start to feel better. However, you are still contagious until every scab has fallen off and new skin has formed underneath. It's important to follow your doctor's advice and avoid close contact with others until you're completely healed. If you develop symptoms, it's essential to isolate yourself from others as much as possible. This means staying home, using a separate bathroom if you can, and avoiding sharing personal items like towels or bedding. You should also wear a mask if you need to be around other people and keep in touch with your healthcare provider for guidance. Following these steps helps prevent the virus from spreading to family, friends, and the wider community. While most people recover without serious problems, some groups are at higher risk for complications. This includes people with weakened immune systems, such as those living with HIV or undergoing cancer treatment, young children, and pregnant people. For these individuals, Mpox can lead to more severe illness, so it's especially important for them to seek medical care early and follow all recommended precautions. By understanding the symptoms and knowing what to expect, you can take steps to protect yourself and others, and help stop the spread of Mpox in your community. In 2025, Mpox hasn't been eradicated, just controlled in many places. Persistent cases continue in some cities, especially in Europe and the Americas. New outbreaks of the more severe Clade 1 have appeared outside Africa, including Southeast Asia. This shows the need for global surveillance and rapid response. In Africa, especially the Congo Basin, Mpox remains a major challenge due to limited healthcare and increased animal contact. International efforts focus on better diagnostics, vaccines, and outbreak containment. The lessen infectious diseases cross borders fast, so ongoing vigilance and cooperation are essential. We've shifted from emergency response to long-term management. The good news, vaccines and treatments for Mpox exist. The main vaccine, JYNNEOS, is safe and effective, used for those at highest risk healthcare workers, lab staff, and close contacts of cases. It's not for the general public, but targeted vaccination helps contain outbreaks. Most people need only supportive care, rest, fluids, and pain relief. For severe cases or high-risk patients, the antiviral tecovirimat, Mpox, can help shorten illness and prevent complications. Prevention starts with education, rapid case identification, and contact tracing. Post-exposure vaccination can stop the disease or make it milder. Combining prevention, vaccination, and treatment keeps communities safe. This layered approach is our best defense in 2025. If you develop Mpox symptoms, isolate immediately and contact your healthcare provider. Call ahead so clinics can protect others while helping you. Trust information from reliable sources like the WHO, CDC, or your local health department. Key tips: know the symptoms. Practice good hygiene. Avoid close contact with sick individuals and get vaccinated if recommended. Quick action and accurate information make a big difference. Mpox is manageable if we stay alert and proactive. Protect yourself and your community by following public health guidance. Thanks for watching. Stay safe, stay informed. Don't forget to like and subscribe for more updates on health and safety.